Meeting is called to order. If you'll all rise with me, please, for a Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Catherine, would you take a roll call, please?
Yes. Director Danielson,
Present.
Director Nicholson,
Present.
Director Stewart,
Present.
Director Wallace,
Present.
Director Ethan.
Present.
We're going to deviate just a little bit from the agenda. We have some very, very special guests here this evening. So I would like to turn the meeting over to Andy Estevez to do the introductions. Thank you.
Good evening, everyone. Tonight is a very special night because my special guest, who was involved in the Washington Hospital Service League scholarship selection for 2011, will share her experience and thought about the scholarship selection. Without any further ado, I would like to introduce Ms. Kimberly Kurtz. She's a physician assistant to Dr. John Thomas Mehigan.
Good evening, ladies and gentlemen, members of the board, scholarship recipients, and friends and family. It is my pleasure to present to you tonight the top 2 Washington Hospital Service League scholarship recipients. First of all, I would like to thank the Washington Hospital Service League for allowing me to participate in this very important and impactful decision. 35 students applied this year for 4 available scholarships. From those applications, 17 students were selected for interviews. Let me just say, all of these students were exemplary. Top of their class, star athletes, community service leaders, musicians, some even started their own charities. So with all of this scholastic leadership and extracurricular excellence, we as a committee had to decide what the primary deciding factor would be for the basis of our decision. We ended up agreeing that we wanted to choose students who demonstrated a true passion for medicine. We wanted someone that wanted to provide actual hands-on patient care and that had a concrete reason on why they wanted to pursue medicine. With that said, I can assure you all that we picked the most excellent and inspirational students to receive these awards. The first student I'd like to introduce is Derek Ho. We were all blown away by his application and letters of reference, but especially by his in-person interview. Derek is planning on attending the Accelerated Medical School program at Penn State in the fall. He is graduating from St. Francis High School and has worked as a research assistant at Stanford. He was a member of the Washington Hospital Medical Explorers Club, as well as participating in the Washington Hospital Volunteer Program. We chose Mr. Ho to be the recipient of the Josephine Walton Yearly Scholarship Fund, in which he will receive $1,000 per year for 4 years. It is my pleasure to introduce to you Mr. Derek Ho.
Hi, my name is Derek Ho, and I'm a graduated senior of St. Francis High School. So next year, I'll be attending Pennsylvania State University for their 6-year accelerated medical program in cooperation with Jefferson Medical College. Essentially, in this program, I'll receive both my Bachelor's of Science degree and my medical doctorate degree in 6 years, attending Pennsylvania State University for 2 years, and continuing on for 4 years at Jefferson Medical College, to which I have guaranteed acceptance. So to talk a little bit about myself, I'm going to answer the question why I decided to become a doctor. Throughout my life experience, there hasn't been specifically one instance that stood out to me. Instead, it was the multitude of life experiences that helped me decide to become a physician. Probably the earliest manifestation of my desire to enter the medical field was my passion for science, acquired throughout my life through education in high school, middle school, and elementary school. What astounded me about science was how our learning is always purposed towards acquiring knowledge rather than simply earning the grade and just studying for tests only. And I found that I was able to become extremely immersed in the class material, and it reinforced my passion for science. But also in science classes, we were able to perform hands-on scientific laboratory experiments where we utilize the scientific method and gains hands-on skills applying theoretical scientific concepts to real-life situations. And what this showed me is that the medical field would really be perfect for me because it encompasses both this hands-on work and applications of scientific knowledge to the real world. Also, my participation at St. Francis's religious programs helped to shape my decision to become a physician. One of the most influential events on my spirituality was the senior retreat that I attended this year. There, the retreat took us away from our home for 3 days and also took us away from school, where we would go into the retreat house and basically do prayer in silence and solitude. But what this experience taught me was various important messages for life. And one specific message that really stuck to me was that performing small acts of kindness can really have lasting impacts on others. And I think what this really shows is that the medical field would allow me to perform many small acts of kindness on various patients, family members, visitors, and I'd be able to provide health care, improve someone's health, or help them with emotional problems or psychological problems, and I'd gain the satisfaction of helping others in need and providing a small act of kindness that could really have a lasting impact on others. And also an important lesson that it taught me in one emotional instance was that there are many people behind me propping me up and keeping me going forward. And I think this is a great time to thank my parents, my family, my friends for helping me get here today, and also thanking the Washington Hospital Service League for providing me with this incredible scholarship for 4 years that will really help me with my financial issues in college. So thanks a lot. And anyway, speaking of Washington Hospital, my volunteer experiences here have really contributed to my desire to become a physician. At the hospital, I've volunteered here as a lobby desk volunteer as well as a critical care volunteer. And through this experience, I've really experienced the incredible wonders of the hospital environment as well as the medical field. And I've been able to interact directly with patients, visitors, other volunteers and hospital staff members, as well as explore all the floors of the hospital, from the ICU overflow on 5 West to the cafeteria on the ground floor where volunteers receive free ice cream, which is really good. What the experience showed me was that the hospital system is a network, is a really complex network where a whole bunch of medical personnel collaborate together and cooperate. But I think what really astounds me is that how it's so unified and it just works completely to provide health care to the community and serve society. But also on a more negative note, the experience showed me how illness can cause pain to patients and the visitors, not only physically but also emotionally. And what my volunteer experience did was it provided the impetus behind my 6-month research internship at Stanford University, where I worked at the psychophysiology lab. There, as a research assistant, I primarily ran experiments on human subjects, attempting to elicit emotion through certain stimulus material, involving the perception of pain or amusement through empathy. And by engaging myself in all aspects of the research process, I've been intrigued by applications of science to real life through this psychological research, and I've experienced how the human capacity for empathy that I witness constantly also here at the hospital. And this has spurred my desire to become a physician to help others through both emotional and physical issues. Also, as a member of Washington Hospital's Medical Explorers Post, I've had the opportunity to shadow medical personnel and participate in multiple simulation labs, and I've found that the direct care of patients really worthwhile to witness. It has reminded me of the rewards of one-on-one interactions with patients at the bedside level, and through the experience, I've shadowed a multitude of specialties in medicine, ranging from sleep medicine with Dr. Nitun Verma or gastroenterology. And what the experience has shown me is that the medical field is extremely diverse and versatile, and I know that it's a field that I'll never become bored in. Also, my participation in this club this year has really realized my desire to become a medical doctor, combining with all the above examples I just listed. And I found that a medical doctor encompasses the most important of vocational values, including scientific knowledge, interpersonal interactions, compassion for others, and leadership in the community. And to me, the medical field would be excellent because it not only is just a career that you reach, but once you reach it, it's something that continues on for a lifetime. Because in the medical field, I can achieve lifelong learning as scientific discoveries continue to increase exponentially. And therefore, I'm truly excited to begin my journey, my 6-year journey towards a career in medicine at Penn State University this fall. Thank you.
Thank you, Derek. I think you can all understand why we picked Derek for this award. Our next student to present to you is Miss Demi Pham. Her dedication to excelling in school and in life is inspiring. She is also a graduating senior from St. Francis High School and plans to attend University of the Pacific's Accelerated Pre-Dentistry program. While excelling in school, Miss Pham also worked as a lifeguard, office assistant, and also participated in Washington Hospital's Medical Explorers Club, as well as serving as a Washington Hospital volunteer. Demi was chosen to be the recipient of the Catherine Fusco Yearly Scholarship Fund, in which she will receive $1,000 per year for 4 years. Please welcome Ms. Demi Pham.
Good evening, everyone. Let's move down. Okay. My name is Demi Pham, and I'm also a graduated senior from St. Francis High School. First of all, I'd like to give my greatest thanks to Washington Hospital for giving me this amazing scholarship because it really will help me in my years in college. I'm extremely excited to be attending the University of the Pacific this fall to be studying pre-dentistry as one of the few accepted students in their 5-year program. In this program, it's intended that I will study as an undergraduate for 2 years and then continue on to the Arthur A. Degoni School of Dentistry for 3 more years to receive my DDS. To tell the story of how I discovered that I wanted to become a dentist, I can't say that it was the dream job of my childhood, but rather I have to rewind back through some of my years in high school. Throughout my life, I was constantly asked the question, what do you want to be when you grow up? And I could never firmly answer this question with a specific occupation. All I knew was that I was extremely drawn towards science, the field of science, and was passionate about healthcare. But with the huge diversity and fields in medicine, it took me a while before I found what I could see myself doing in the future. During my sophomore year, I began volunteering at the lobby desk at Washington Hospital, and thus began my first and true exposure to the healthcare community. I was extremely curious with everything, and I indulged in all the opportunities and experiences that Washington Hospital had to offer me with each volunteer shift. Whether it was discharging a mother and her newborn or delivering pharmaceuticals to the intensive care unit, I soaked it all in and I enjoyed every moment of it. My many hours spent volunteering reaffirmed and reinforced my passion to study healthcare and to go into that field. I later joined the Medical Explorers Post after finding out about it through my volunteer work, and attending the different presentations really exposed me to all the different fields and specialties. I considered pediatrics and even obstetrics and gynecology, but as I looked more into the fields, I couldn't see myself in them in the future. And as a certified lifeguard, I work year-round as a lifeguard and a private instructor. So I work with kids and adults with all ages, and I also have the responsibility of providing immediate care in life-threatening situations. And while I do enjoy this, I can't see myself doing something like this in the future. Rather, I ultimately want a career that's stable and family-oriented, and wouldn't consist of daily frantic situations between life and death, but rather a career that would enable me to comfortably help people's basic needs and still give back to the community. And this is what I found in dentistry. I attended a presentation by a dentist, and I was not only drawn in by what he was talking about in his profession, but with the charm and the happiness and vigor that he spoke about his profession with. And so I began shadowing different dentists and orthodontists, and I was very surprised with what I experienced. It wasn't anything like the 6 months cleaning that we are also used to, the clean, the flossing, and the rare cavities, but I saw the great variety of procedures and how important the job of a dentist was. In my first shadowing experience, I was immediately drawn to the field after seeing how all the different patients and how the dentist would have to adapt to every single person or in a certain way. For example, one boy had autism, and so the doctor had to use laughing gas to calm him down before injecting Novocaine for a filling. And this actually reminded me a lot of what I do as a swim instructor, because during the summer I teach kids with disabilities, and oftentimes they're autistic. So I find myself, I really enjoy the challenge of having to change my teaching style to fit a kid's disability. Despite witnessing many different procedures while shadowing, there was one particular patient that stood out to me and solidified my attraction to dentistry. A man came in to get dentures on his bottom jaw, and he'd gotten 3 metal rods implanted into them 10 years ago by an oral surgeon. But for reasons unknown, whether it was financial or other, he never got dentures made for them. So for 10 years, he was chewing with his top teeth and 3 metal rods on the bottom. And of course, metal versus teeth, the teeth had begun to chip and get damaged. So the dentist was fitting in these dentures for him, and he made it so that the teeth would close right on top of each other. And I asked him about this, and he was saying how, unlike people normally chew in the back, and their bite is normally an overbite. But for this man, he had grown so accustomed to chewing in the front that he had to make it so the dentures would close right there so he could chew in the front. And this experience really appealed to me greatly, just because it showed me how every patient is completely different, and even if it's out of the ordinary, a dentist really has to adapt to that personal need. And by shadowing dentists, I discovered so much more in the profession, and I've gained a great appreciation for oral healthcare professionals. I came to love dentistry even more when I realized how much art and dexterity is incorporated into the profession, especially with all the carving and the molding that went into these dentures. Having played piano and guitar for many years, I have gained a manual dexterity that will greatly aid me in my dental practices. Similar to music, I find dentistry a very satisfying profession because it allows me the opportunity to do something that I love, which is to work with my hands and to provide services that will enhance a person's comfort, confidence, as well as happiness. A person's ability to eat is something basic. It's an everyday necessity, and I find it very rewarding to be able to provide that comfort and to enhance it. And at the same time, it satisfies me greatly to see a patient's proud and confident smile and know that I helped to create that. And although I know my journey to become a dentist will be difficult, I'm tremendously grateful for all the love and support that I know I have behind me. Throughout my life, my parents have given me so much, and they stuck behind me every step of the way. They came to America during the time of the Vietnam War with nothing but the clothes on their backs. And with their hard work and dedication, they built up their lives in an entirely new and foreign country with new customs and language. My parents are an inspiration for me, and they motivate me to really work towards my goals, and I would not be where I am today without them. My parents, my teachers, and my experiences throughout my life have kindled my aspirations to study dentistry and to become successful during and after dental school. Dentistry combines my passion for biology, my affinity for healthcare, and my desire to work with patients and serve my community. There are unique aspects in dentistry that I think can draw anyone in, and for me, I'm very excited to begin this journey, to learn about dentistry and to continue learning throughout the years. And I'm very privileged to be starting a career so giving and so respectable. Thank you.
Thank you, Demi. Thank you, Derek. Thank you, Kimberly. Will you join me? Will you guys come over here, please? Well,
Thank you, Andy.
yeah, you're
Thank
welcome.
you
Thank you,
for-
thank you, Derek again, and Demi, and Kimberly for being here tonight. Those were wonderful words.
Very,
Thank you.
very impressive young people. And I hope that when you finish your educational goals, you think about coming back to this area and putting yourselves into practice right here. Good luck to both of you. You're very, very impressive young people. I'm awed at what you've been able to do. Oh, thanks, Andy.
Thank you.
Now we'll have our educational session.
Yes. This evening is the presentation of the next fiscal year's budget. Our Chief Financial Officer and Associate Administrator of the hospital, Chris Henry, will be making this presentation. I want to remind people a little bit about Chris. He has a CPA. He attained his Bachelor of Science degree from Cal State University East Bay in September of 1995 in business administration with an accounting emphasis. He worked in public accounting for 4 years, after which he was certified as a public accountant. He joined Washington Hospital as the Director of Accounting in May of 2000. In September 2003, he took over the position of Controller. And since October 2006, Chris has served as Washington Township Healthcare District's Chief Financial Officer. And in October of 2010, he took on the additional responsibility of being an Associate Administrator. He's a member of the California Society of Certified Public Accountants, the California Hospital Association Healthcare Financial Management Association, the American Institute of CPAs, and the California Society of Municipal Finance Officers. He also serves on the California Hospital Association's Chief Financial Officers Advisory Committee and is active on the District Hospital Leadership Forum. He also serves on the Board of Directors for the George Mark Children's House as its treasurer. And with that, I'd like to turn the meeting over to Chris Henry.
Before I get started on this, I'd like to make a few acknowledgments. This budget is the culmination of a lot of people's work, and all deserve credit. Our entire management staff has had input into this. I want to thank our associate administrators, Jan Wood, Ed Fayen, and Kimberly Hartz, for the hours and hours of meetings in pulling all this together. I want to acknowledge Dan Nardoni, our director of the budget, Terry Scott and Colleen Dorr, who all spent a lot of time pulling all the information together and getting it into a form that we can digest. And finally, I want to thank Nancy Farber. Without Nancy's guidance and leadership and knowledge and hours as well, this budget would not be in the condition it is to present to you tonight. So thank you, Nancy, for your time. The budget for 2012 is being presented and prepared in an environment that's not unlike what we've faced in the last few years. And our budget is the financial expression of our mission statement. The conditions this year, as I said, are not unlike what we've been facing in the past few years. It's been prepared in an environment where we know there are massive changes coming to our industry as a result of the recent healthcare reform. The continued budgetary insolvency at both the state and federal levels are driving real reductions in reimbursement from government programs. And in the district, the economy and unemployment continue to be a challenge for our district residents. At the local level, the economy and unemployment continue to be a challenge. Although the most recent numbers on unemployment show a reduction in unemployment from 8.4% this year from 9.4% last year, it's really apparent that reduction in the unemployment rate is more a result of people dropping out of the labor force than a real increase in employment. The East Bay Economic Development Alliance, which is a group of economists that focus on the economic developments here in the East Bay, continues to be cautious about its outlook for the future of the East Bay economy. However, in their most recent report, which was republished in April, they do say that they expect that the economy will begin to pick up slowly in the coming quarters, with improvements in unemployment beginning in the first half of 2012. So that's good news. The group also notes that once the East Bay works through the impacts of this economy, they do expect it to become one of the stronger growth markets in the state as it was prior to this economic meltdown that we've been experiencing. So there's good news there. Budget woes at the state persist, as we all have been hearing, driving continued pressure to cut expenses spent on health care for Medi-Cal recipients. This year, the state did try to roll back rates to January 2010 levels. This would have been a reduction in the rate that we received from the state, as we got an increase in February. But at this point, the courts have blocked this attempt, and it's still working its way through the appeals process, but at this point, the state has been unsuccessful in implementing that rollback. What they have done is freeze rates at the current levels until a new payment system is implemented in the state. Now that system's in the early stages of development. It looks like it will be a Medicare-type, severity-based system, but it's still early and it's difficult to tell what the real impact will be on reimbursement from the new system. But we have to keep in mind that the state's goal is to reduce its expenditures on health care for Medi-Cal. So I think we can expect once that new system is put in place, we will be receiving less money from the state. Given the dismal state of Medi-Cal reimbursement, hospitals in California have banded together to try to take things into their own hands. One of the issues is that the state for years has left federal matching dollars on the table at the feds in the amount of about $2 billion because they refuse to put up the general fund money to go and get those matching funds. So what has happened this year is hospitals have banded together through California Hospital Association and a new group called the District Hospital Leadership Forum to pass legislation allowing hospitals to put up their own money through hospital provider fees and through intergovernmental transfers to allow the state to go and get those additional dollars and bring them back. And while that's helped, it's fallen far short from covering the gap between Medi-Cal reimbursement and cost. In 2010, Washington Hospital received reimbursements from the state that were $38 million less than the cost of providing the care to Medi-Cal beneficiaries. So we continue to have problems on the state level. Continued pressure on reimbursements from the state's only going to exacerbate the problem. It will continue to shift costs on the providers and make that gap grow. At the national level, the Accountable Care Act continues to be controversial. There's a real disconnect between the stated objectives of the law and the nation's ability to fund it, and that's becoming very apparent the more the debate goes on. The cuts in Medicare spending that began last year are continuing and accelerating this year. Again, this year, the market basket adjustment, which is supposed to be our rate increase to cover inflation, has been offset by a behavioral adjustment. And that offset will result in a real reduction in our reimbursement from Medicare to the extent of about $2 million. And that hits right to our bottom line. Also, the controversy that began last year around reductions in the physician fee schedule from Medi-Cal have remained unresolved. The legislature continues to kick that can down the road for future legislative bodies to deal with. That is a $300 billion problem in the government's plan for health care reform. And really what they're doing is pitting physicians and hospitals against each other, fighting over reimbursement rather than working together to solve the problem. Regulations released this year related to accountable care organizations were disappointing. And in fact, two of the largest organizations that the government was really counting on it being early adopters, Geisinger and Mayo, have stepped back from implementing accountable care organizations because the model is unworkable, and it's becoming very apparent as they look through that. Further clarity on health care reform will come as more regulations are written. But with the election coming in 2012, we think that the controversial regulations will be deferred until after the election. Also, the really meaty, as we mentioned last year, the really meaty and controversial provisions in the Act don't occur until 2014, well after the election. As with Medi-Cal, Medicare does not cover our cost of providing care to Medicare recipients. In 2010, the shortfall in reimbursement from Medicare was $68.1 million less than our cost of the provision of care to Medi-Cal benefit or Medicare beneficiaries. So that gap continues to grow. There are other expense-reducing initiatives on their way, including the government's refusal to pay for readmissions, hospital-acquired conditions also they're not going to pay for, and value-based purchasing is really an instrument to reduce payment. So that gap is going to grow in the coming years. And as always, private insurers continue to look for ways to improve their bottom line and reduce their costs. They're doing this by working both ends of the equation. They're increasing their premiums to their members and demanding payment concessions from providers. In the most recent quarter, at the first quarter of 2011, for instance, United Healthcare recorded record profits. They recorded an increase of 13% from the same period in the prior year. And reported $1.3 billion in profit for that first quarter. Likewise, WellPoint reported a 5.7% increase in their profit at $926 million, and they continue. And you can bet that they will follow the federal government as they implement their cost-cutting measures as they always do. So we're going to continue to see pressure from private insurers as well as government. But in the midst of all this turmoil, Washington Hospital continues to be strong. We have historically been a resilient and resourceful organization, and we're prepared to react quickly and decisively to the changes that we know are coming to us. Once again, the current year has been very successful on many fronts. Under the board's watch this year, we continued our construction on our new Center for Joint Replacement and Power Plant projects, and we expect to wrap those up in the coming year. We opened a new hyperbaric and outpatient wound clinics that have been very successful. We filed our application and documentation for our nursing magnet status. That application was received with no questions, no request for additional information or clarification, and that makes us one of 2 or 3 organizations in the history of that program to have accomplished that. That puts us in company with organizations like Baylor. So congratulations to our nursing staff and all their hard work on that. The year saw a number of awards presented to Washington Hospital, beginning with the Ohlone College Citizen of the Year Award. Our environmental initiatives received a couple of recognitions. We received the Stop Waste Business Efficiency Award for outstanding achievement in waste reduction and environmental performance. We also received the Practice Green Health 2011 Partner Award for Change in recognition of achievement in developing programs around our environmental issues. So that's great recognition. Professional Research Consultants, PRC, awarded us the 2011 National Excellence in Healthcare Award for outstanding quality of care in orthopedics, anesthesia services, and medical records. Our Center for Joint Replacement continue to receive accolades. PRC awarded them for the 6th year in a row the 5-Star Excellent Award and Top Performer Awards. This places our joint replacement program in the top 10% of joint replacement programs in the country. Also, the joint replacement program received HealthGrade's joint replacement program. They named that program #1 program in the state. So again, great recognition for our joint replacement program and all those orthopedic surgeons working in that. The stroke program also received an award from HealthGrades this year. They received a 5-star award that ranks Washington Hospital's stroke program in the top 15% of programs in the country. And Health Grades, again, a third award from Health Grades this year for our patient safety. It's an award for patient safety excellence that placed Washington Hospital in the top 5% of hospitals in the country for patient safety. Pretty good results there. During the year, we again received an affirmation of our A3 positive rating from Moody's in an environment where Moody's continues to be extremely negative on not-for-profit healthcare. So that was quite a feat, and again allowed us to easily obtain the additional financing needed to finish up our CJR and power plant projects. The coming year again will be characterized by a commitment to continue to be relevant to our community during a time of continued economic and industry change. We'll be doing these things in an environment of continued uncertainty. While the economy appears to be stabilizing, it is fragile and still could easily be upset. And a real financial and operational impacts of healthcare reform and the state budget will continue their downward pressure on our reimbursement. As in past years, this year will require intense monitoring so that we can react quickly and decisively to the many anticipated changes that are presented to us moving through the year. And let's get into the numbers. The fiscal year 2012 budget will provide for coverage of all our operational expenditures in the amount of a little over $483 million. Including funding of depreciation of $21.1 million, the funding of contributions to our retirement plan, about $19 million, debt service on our revenue bonds in the amount of $15.2 million. It will provide operating income of $26.4 million, which is 5.2% of our net revenue, and total net income of an estimated $41.3 million and a net margin of 6.6%. It will also provide for Measure FF property tax revenue to service our general obligation bonds in the amount of about $7.9 million. And the budget is in compliance with all of our bond requirements with a debt service coverage of 3.1 to 1. It provides new capital spending requests of $7.6 million and provides the funding for our major facilities and IS program spending, including our Center for Joint Replacement, Central Plant, and Electronic Medical Record. So a quick look at our income statement. We'll be diving into the details of this as we go along. The budget provides total operating revenue that is expected to increase about $3.2 million. It gives us a 4.5% increase in operating expenses and a bottom line that is still very strong at $26.4 million or 5.2%. Let's take a look at our volume indicators. You see our admissions and patient days. Average daily census all up about 2%, and that's being driven by volumes that we'll get into down below here. Deliveries for 2012 we don't expect to increase. We expect that to be stable at about 1,950. We do see surgical cases increasing about 4.5%. That's coming from joint replacement cases, our cardiac surgical cases, and neurosurgical cases, as we expect those programs all to continue to grow. We expect about a 7.8% increase in cath lab volume, and the majority of that coming from vascular procedures with our neurointerventional program. That program has been growing leaps and bounds, and we expect it to continue next year. Non-ER outpatient visits, we expect to grow about 1.1%, and that's coming from our new hyperbaric and outpatient wound programs. Those programs really have grown this year, and we see that growing next year as well. Emergency room visits, we expect to continue to increase about 1%. That has been on an upward trend, and we don't see that stopping in the next year. And our case mix index up about not much, about 1.2%, really being driven by the mix in our services in the coming year. Get into some of these details. Admissions, again, you see, we expect about a 1.7% increase. And as I said before, that's being driven by the increase in our OR volume and our cath lab activity and neurointerventional radiology procedures driving that number. Inpatient days continue to increase. That's an increase of about 2.3% in 2012. And comes from three things. It's really our changes in service mix. We are seeing increases in services that require longer lengths of stay. But the other thing that we're seeing is we're having more long-term patients that come here, have critical long-term problems, and there's no place to put them. For instance, right now we have 3 folks in-house, and the 3 together account for 679 patient days and $15.7 million in charges. These are folks that have chronic long-term issues, and there's no place to place them once we get them, once we have them. So that's driving a lot of our increase in patient days. Deliveries, as I said, we did see a drop in 2011, but that looks like it's stabilized. We expect it to remain stable in 2012. Surgical volume, again, we expect an increase of about 5.4%, and that's coming from increased cardiac surgical cases, increased joint replacement cases. That program continues to grow, and increased neurosurgery cases as well. Those volumes are on an upward trend, and we can expect them to continue that way, and some small increases in general surgery. Outpatient visits, again, up about 1.1%, and that's been on a increasing trend. And again, this year, what's really driving that volume is our hyperbaric and wound unit programs. And again, the trend in emergency room visits, that number has been going up year after year for the last 5 years, and we don't expect it to stop. And again, a look at the case mix index, really being driven by the mix of our services with the increases in surgical and cardiac services. Just a quick glance at our admissions by payer. Really pretty stable with the exception of a little bit of an increase in Medicare. We're starting to see the baby boomers hit. We expect that number to start growing over the next several years. We do expect more Medicare, and really that's being offset by a decrease in Medi-Cal, which is kind of an interesting relationship. PPO staying very stable, as well as HMO and private. So really a shift there. Quick look at our performance indicators. We expect our total paid FTEs to increase 1.3%. And again, those increases really driven by the volumes that we're expecting to see. We do see a slight decrease in our FTEs per AOB next year as we implement some productivity measures to increase that. We get into the gross revenue. So patient service revenue is expected to increase about 3.3% in 2012, with contractual allowances increasing 4.3%. And what you're seeing there is really the change in the payer mix and the decreases we're getting from the government payers, increase in Medicare, and continuing pressure down on reimbursement. So net patient service revenue we expect to increase about $3.2 million. Then we layer on our provision for bad debt and charity, and we are really seeing that number stay stable. We don't see an increase in the provision for bad debt and charity as a percentage of gross revenue. What we see is a shift within that number between bad debt and charity, and it's really what we've been experiencing. So when we get to the bottom line, the total net patient service revenue after bad debt and charity, we expect to increase about $1 million to $435,014,000. Here's a quick glance at what's going on with our government payers. Well, I discussed this a little bit earlier, but this kind of puts it in a little bit more perspective. Again, for Medicare, the cost of the provision of care for Medicare recipients in fiscal year 2010 was a bit over $184 million, upon which we collected $116 million from Medicare. That meant Medicare covered about 63% of the cost of the provision of care to their beneficiaries. Likewise, with Medi-Cal, about almost $63 million in cost for Medi-Cal beneficiaries, for which we collected just under $25 million. Medi-Cal covering 39.5% of the cost of provision of care for their beneficiaries. And as the government payers continue to squeeze reimbursement, we're going to see these differences increase. And it kind of makes you wonder about the wisdom of them dumping millions of folks into the Medi-Cal program when they already can't cover the cost of the provision of care. So there's a real funding issue there for these new programs. Gross revenue by payer, similar to the payer mix we looked at earlier, about a 3% increase in our Medicare revenue for the coming year. Medi-Cal, most of that coming out of Medi-Cal, PPO, HMO, and private staying pretty stable. Here's a quick look at our room rates. We do look at our pricing every year. And again, this year our room rates are going to fall right within the range of our market. They tend to be on the low side of average, but there are some differences in the way hospitals price their services. Many of them tend to capture more of their costs through room rates, others through ancillary services, and we tend to capture more of ours through our ancillary service prices. We have looked at our overall pricing in the market and feel that we are adequately priced in the market, that we're correctly priced in the market, so we're not proposing any wide-ranging pricing changes for the coming year. Here's other operating revenue. We are expecting some increases in here, about a small increase coming from our cafeteria, about 6.1%, as we try to capture our increasing food prices. We are going to do some pricing adjustments there. You see the other bucket, which includes a lot of the ancillary services that we provide on contracts, such as janitorial and laundry and cleaning and medical imaging and lab services. We are providing more of those services to outside organizations, so we expect about a $200,000 increase coming from $300,000 increase coming from those services. Okay, now we'll get into the detail on our operating expenses. Salaries, we'll start with. Expect about a 2.7 increase in our salary expenses. That's primarily driven by volume, the volume changes that we discussed earlier, and of course our market and contractual based wage increases. Benefits we expect to go up about 8%, and that's coming from all the usual suspects. Our health and welfare, pension and post-retirement benefit, stop loss, and employer taxes are all increasing in the year. Employer taxes, of course, increases, our wages increase, and our pension and post-retirement and health and welfare are inflation-driven and participant-driven. We also are expecting a small increase in our workers' comp expenses in 2012, driving that difference. Professional fees, we're expecting about a 1.5% decrease there. And that decrease is coming from the hiring of our new CIO and replacing a contract person for that. And also some timing differences resulting from timing differences in projects. Some of the projects are being pushed out a little farther into next year, but we do expect those costs to come back in the following year. Supplies, we're expecting an increase of about 1.8%. And again, those being driven by volume and inflation. We are expecting some decreases in our supply costs coming from a new GPO arrangement, group purchasing organization arrangement, and we intend to implement a 403B pharmacy program, which allows us to buy pharmaceuticals for low-income patients at a reduced rate, and that'll provide some significant savings for our pharmaceuticals. Purchase services, we expect about a 7% increase in our purchase services in 2012. And that number is being driven a lot by our preparation for our implementation of Epic. We also have some money in there to complete our nurse magnet program, and that will be completed this year, it sounds like, with our successful application process. We do have some expenses in there for the upcoming election, and we do that every other year, so that's driving an increase this year. And we have some increases for repairs and maintenance in our communications and biomed areas. Utilities, we're expecting about a 10.8% increase, and that's largely being driven by bringing on 2 new buildings online and an increased square footage to provide utilities to. There is also some provision for inflation in that number, but the majority of it being driven by our new buildings. Insurance, our insurance costs, we expect about a 6.2% increase. We are getting some increases in our rates on our liability insurance from Program Beta. And again, as those new buildings come online, they will follow our property insurance and away from the construction insurance that's currently held on them. So those things are driving that increase. Marketing and advertising, we expect a reduction of about 3.3%. That's not really a decrease in our marketing efforts. We have just done a lot of work here towards the end of the year that will spill into the next year, and we'll receive the benefit from that. Software licenses and maintenance continue to rise as we implement more software programs and update the ones we have and upgrade systems. So those expected to increase about 27.6% in the coming year. Other expenses. Increase there is primarily due, and that includes most of our leased property. And we do have some increases there from the new space we have leased for our hyperbaric and outpatient wound clinics and for maternal child health and diabetes ed. Depreciation and interest expense. What we're seeing there is what we've been talking about the last few years. As our major capital projects come online, the depreciation and interest expense associated with those projects are going to start to come into our income statement. So the increases you're seeing in depreciation are the result of the power plant coming online about mid-year and the CJR later in the year. Likewise, the increase in interest expense is the result of those projects coming online and the interest no longer being capitalized to those projects. So in all, about a 4.5% increase in our expenses projected for next year, or about almost $21 million. Here's a glance at our distribution of operating expenses. Really no change here. This has been amazingly stable over the past few years. Just some rounding differences happening here, but again, really consistent with what we've been experiencing over the past several years. Here's a quick look at our labor expenses. Again, the majority of the increase on a percentage basis coming from our benefits. We do expect total labor expense to increase about 4.2%. But our labor expenses as a percentage of total operating expense staying pretty close to what we had this year at 54.8%. This is a summary of our non-operating income. We do expect our investment income for the year to drop slightly. We don't expect the same rates of return that we've gotten on our investments this year, and that's largely market driven. Rental income we do expect to increase in 2012, and that's a result of better occupancy. We did have some vacancies this year that are filled. As always, we do not budget for our gains and loss on sales of investments or our unrealized gains or losses because we just cannot predict what the markets will do through the year. So again, about 11% decrease in our investment income and rental income. Here's a summary of our capital budget. We expect about $5.8 million in capital projects, both IT and non-IT, and almost $2.7 million in equipment for a total capital request that we'll be bringing in front of you of $7.588 million. We do also expect about $74.6 million in spending on projects that you've already authorized, the majority of that on our Joint Replacement Center, EPIC, and the central plant. We do have other projects in the amount of $25.3 million for continued spending for total cash flow impact of $82.2 million. A little more detail on our capital projects. These are the projects that we expect to bring in front of you in the coming year. We desperately need to replace our parking lot at the 2500 building, and there is a kitchen pipe replacement that has to happen. Those two projects amounting to about $1.5 million. We also intend to do some renovations in our OR rooms 4 and 5, and we have a number of smaller projects totaling about $158 million that we'll be bringing in front of you. For IT projects, we've budgeted to replace our lab system, which has been problematic over the years. We have a service desk tool that we need for managing all of our IT problems. Not that we have IT problems, but you have IT problems when you have this many systems, and this will help them manage the issues. We have budgeted for McKesson upgrades, even though a lot of these systems are going to be replaced in a few years. We have to keep them current. So we have budgeted some money for that. We have budgeted for a security incident and event management system. This will protect our IT systems from intrusion, and it's something that we really need. And also other IT projects totaling about $695,000. This is a look at the continuing spending on our major capital projects. In the coming year, we expect the central plant and Center for Joint Replacement projects to wind down, so the spending's a little less this year, about $20.5 million for the two, and we expect spending for EPIC, our electronic medical record, to ramp up in 2012 to the tune of about $28.8 million. That money will all come, for the majority of it, from our revenue bonds that we financed, and about $6.5 million from hospital operations. And that's our budget for 2012. And I'll open it up for any questions.
Questions?
I guess my question for Chris is, what was the most difficult thing about trying to get your hands around the healthcare reform and how that would impact our budget?
Well, we can really only go off of what we know, and then try to put some conservatism in the numbers for what we don't know. We do expect government reimbursement to decrease. It has to. The state hasn't got the money. The feds are on a mission. So we provide some for unknowns, but really it's based on what we know.
We don't have any crystal balls.
No crystal balls. I wish I had it.
Yeah, I know. That'd be nice.
Yeah, I think that the worst of what's to come will come after the election, for obvious reasons. So we can plan on next year, hopefully, being somewhat like the previous year, with some known reductions. We know that the regulations for value-based purchasing are going to come out, and it doesn't have anything to do with achieving value. It has to do with reducing reimbursement. We know the feds have a $300 billion problem with what they euphemistically refer to as the sustainable growth rate. And what they have on the books in order to solve the problem is a 29.9% reduction in what they're going to pay physicians for caring for patients. Understandably, they want to be extremely cautious about doing that, because if they ever implemented that, they would find Medicare beneficiaries without physicians willing to accept them in their practice. That is something that has already begun to happen in physician practices across the country. They're also looking at things like geographic variation, and the new gospel, according to the Dartmouth Atlas, is now something that's much discussed. And they want to take money away from the more expensive regions and reallocate it to other regions where the reimbursement has not historically been as good, regardless of what the labor costs are. So there are some big problems there in the regulation and in the law, and how they decide to regulate it will have everything to do with what happens to our bottom line and our ability to fulfill our mission. There are other things, though, more locally, that we have to be concerned about. One that troubles me greatly is what the future of San Leandro Memorial Hospital is. We know that the Sutter system that leases it from Eden District is prepared to turn it over to the county. The county is prepared to close down that general acute care hospital and its emergency room and move their rehab services out of Fairmont's campus. The reason for doing that is because they no longer meet seismic requirements as of 2013. So they wouldn't be able to operate in that facility. It's understandable why the county's looking for a new home. I don't fault them for that. But the idea that they would close down that emergency room is of grave concern to us. It seems like it's very far away. It isn't. BART is in our parking lot, and many of the people in the North County that go to Highland or go to San Leandro because they don't want to wait at Highland will get on BART. And our emergency room is the second busiest in the county. The facility is undersized for its mission, even though we're making some interim improvements. They don't even begin to address what's needed to handle the volume we have now. So I worry about what will happen to our emergency room in the context of a discussion that's playing out in the North County. St. Rose is also a busy emergency room, and they'll feel that direct impact as well. They're the closest to San Leandro Memorial. I know there's many things that will happen between now and when that final decision is made. I worry that it won't be made in favor of the citizens of San Leandro and that they will lose their hospital. And that will affect all of us. We don't live in a vacuum. What happens in one hospital in Alameda County affects the other. So we have those more immediate local concerns. So I think what made the budget so difficult is the amount of uncertainty has escalated dramatically in a matter of months. And it's all around us, and the way we get paid for what we do or the way we don't get paid for what we do is changing, and it's becoming a more acute problem. It makes our business a great deal less predictable. People talk about whether or not there's going to be a second bump to this recession come depression, and we don't know if that's true or not. We wrote this budget as though that were not occurring. So maybe we're overly optimistic. If necessary, if economic conditions change substantially or regulations change so substantially that they alter the fundamental nature of our business plan, we'll have to come back to the board to discuss budget revisions. To the best of our knowledge, this is what's it's gonna look like for next year. But it's getting progressively less and less certain. And it was not so much a struggle, but a lot harder to get this budget done and for all of us to achieve agreement over what it provides for.
I'm glad I'm not Chris.
I think, Chris was mentioning some of the people that helped him in his department, and you might have them stand up and introduce them.
Yeah, the ones that are here. Dan Nardoni, who is our budget director. Terry Scott's here. Terry's our director of accounting, and Terry spent a lot of time working on the budget this year, which was new to him, and that's great to have him. And Colleen Dorr, my executive assistant, and Colleen puts up with all of us and keeps us on track and gets things printed and ready to go. So Colleen's spent an enormous amount of hours on this budget, and I thank all of you for that.
Tremendous job, thank you.
Sure.
Well done. Any questions from other board members? All right. Moving on, we have a consideration of minutes for May 11th, 23rd, 25th, and the 31st, and June 5th of 2011. Do I have a motion?
So moved. Second.
Have a motion second. Any discussions? All in favor?
Aye.
Minutes are approved. Thank you. Catherine, do we have any oral communications? No? Thank you. Written communications, Dr. Hensdorf, please.
Thank you, Madam President. Medical staff would like to recommend appointment and clinical privileges as delineated for Christina Lee in medicine, Dr. Nguyen in pediatrics, Dr. Islam in pediatrics. We would like to recommend granting 2-year reappointment with privileges as indicated for Igor Bedorov, a registered nurse first assistant, Dr. Carlson, Dr. Sipi, Dr. Chakravorty, Dr. Diol, Dr. Santos, Dr. Hoffman, Dr. Johnson, Dr. Kalaru, Dr. Mayant, Dr. Saxena, Dr. Scott, Dr. Singhal, Dr. Townsend, Dr. Upinder, and Dr. Wong. We would like to recommend the remainder of a full reappointment for Dr. Mahegan. We would like to recommend a 6-month conditional reappointment for Dr. Stanton Schiffer with conditions. We would like to recommend discontinuation of proctorship and advancement of staff status for Dr. Cleese in pediatrics. We'd like to recommend discontinuation of proctorship for Peter Barnett in emergency medicine, Dr. Becker in anesthesia, and Dr. Shrivasta in gastroenterology. We want to recommend continued proctorship and continued provisional staff status for Dr. Khan and Dr. Stanton in cardiac surgery. We would like to continue proctorship and extend for 6 additional cases that proctorship for Allison Robbins in pediatrics. We would like to recommend transfers in staff status for Dr. Mayant from active to courtesy, Dr. Townsend from active to ambulatory, and Dr. Angela Wong from active to ambulatory. We would like to recommend that you grant additional privilege for Kimberly Kurtz, who you heard from this evening, to include central venous line placement and removal. We would like to request that you reinstate Sandeep Gupta, who completed a sports medicine fellowship to add to his family practice acumen. And we'd like to recommend that you accept the resignation of Dr. Villanueva, who's relocating out of the area.
Do we have a motion for
So
approval?
moved.
Second?
Second.
Have a motion and a second. All in favor?
Aye.
Motion passes. Thank you. Andy, you're back up again.
I don't have any other report than the one that I just did.
Okay, you started the evening out with
I
a
just
bang.
started the evening, yes.
Well,
Thank you.
Thank you very much. That means that we're back to the medical staff report and Dr. Hensdorf.
I was hoping he'd give me a break from talking for a while.
Well, we could go back. Maybe Andy can come up
I
with
can
something.
use you if you want.
I'm ready.
Okay.
I wanted to announce that we have currently 516 members of our medical staff now. And when you add the active participants and the provisional active participants, it's actually 400 people in that category. That's a large medical staff. It's much larger than when I was doing this in my last tour of duty.
Now, do you remember what it was when you?
It was approximately 250. I think
No,
we've
for
doubled.
this term. This term is.
I mean, when I began this term,
Began this term as chief of staff.
I don't recall, but I think it was just over 400. I think in the last 2 years, we've added almost 100 people.
Good job.
It's a large group. And in that spirit, we've recently sent 22 pre-applications in the areas of pediatrics, family practice, internal medicine, pediatric GI, radiology, telemedicine, emergency medicine, pulmonary critical care, pain management, including 2 physicians in anesthesia and a physician's assistant requesting applications for pain management, as well as ophthalmology. We're currently processing 15 applications, including specialties of medicine, pediatrics, perfusionist, and allied health, rheumatology, pediatric hospitalist, GYN, oncology, and reproductive medicine, a physician assistant in orthopedics, family practice, a physician assistant in cardiology, medicine pulmonary, and medicine infectious disease. And we're anticipating sending 3 more applicants to you for appointment at the next meeting. And that's my update for you.
Thank you. Nancy, we're back to item D, which is quality report with Stephanie Williams.
I'd like to begin with the construction update and ask Ed Fan to give that report.
Thank you, Nancy. So our construction report for this month is continued steady progress. I think as we get to the, this is actually the central plant, you can see that we're getting to sort of the fine points or the fine touches around the central plant. So this is out in front of the laundry, and it is a planter and bench mechanism, I guess you could say, and there you see it with the molds taken away. So there will be some seating and some garden area in front. Here you see an area. This is actually the main entry, which is sort of the northeast back of the building from where we sit in the hospital, but it's the entryway. And so we've got the forms that have been put in place, and you can see they're starting to get ready for paver stones that will make the rest of the walkway in. This is just concrete. You can see again the planter and bench area, and then concrete separation for the pavers. So it's going to be a very attractive entryway and side viewing point from the rest of the hospital. And also this will be one of the things that'll be able to be seen from the new building that goes up, the new critical care and ED building. This is the north side again that we're grading. So most by the end of the month, most of the grading and paving will be done around the entire building. I just wanted to show you this briefly, and it's just showing the rest of the building getting buttoned up. So this is something you've seen before. These are a side shot of the boiler room and 2 of the main boilers. The exterior has been one of the main entryways into the building for construction, and this is now starting to get buttoned up, so you can see the framing going in, the louvers, and then roll down doors. So most of the building at this point is pretty well buttoned up. I'd say 99% of the equipment is in there. We have a few dryers that have to be put in, and then we have some equipment that gets rolled over from the laundry. Here's some of the washers, the new washers that have been put in place in the past 30 days. So let's move on to the CJR. And this is just showing you some of the mechanical plumbing that's coming over actually from the utility tunnel over to the CJR building. You can see that they're still buttoning up sort of the undercarriage of the building, and then you can see the skin is continuing to be put on. We have a few basically corner sections of the building that still remain to have the skin put on. This gives you sort of a shot this is a shot from the hallway that is now attached to the main building as you enter into the CJR. And this just shows that we've now got an operational elevator in the CJR. So I think we're still, budget-wise, we're still in very good shape on both projects. Time-wise, we're still running right on time for the central plant, and commissioning work will begin in earnest in July. And for the Center for Joint Replacement, we're moving forward on time there. You know that we added the 3rd floor, so our time frame to be complete for the central plant is January of 2012. Our time frame to be complete with the CJR is probably around March of 2012, and we won't move into it for probably another 60 days after that. So we're tracking well on both projects. Any questions?
Questions? Fantastic.
Thank you.
Okay, then we'll go on with the events of May. Starting on the 12th, we had our second annual celebration of life for cancer survivors. And Dr. Vandana Sharma, oncologist and medical director of our genetics counseling program, hosted this program, along with Kimberly Alvare, registered dietitian. Dr. Sharma presented a talk on how cancer survivors can stay healthy, and Kimberly Alvare presented a program on healthy foods for cancer patients and cancer survivors. And that's something I think that she does especially well. We had 112 people attend, which is very heartening. On May 15th, we had a community event, the Oakland A's Little League Day Tailgate. And over 1,000 Little League players and their families attended the event. Our Washington on Wheels mobile health clinic was at the Oakland Coliseum, and we provided tours of the mobile health clinic and information about the hospital's programs. On the 16th, we had our foundation event, the 26th annual golf tournament at the Sunol Valley Golf Club. This is a tournament that benefits hospice care and cancer services at the hospital. We had 170 golfers who braved rain and wind, and a total of 230 people who attended the awards dinner. The golf tournament is held in memory of Jean Angelo Pisano, and it cleared just over $100,000. On May 17th through the 19th, the Institute for Safe Medication Practices was here at Washington Hospital, and they presented some programs on risk identification in the medication use process. They reviewed a number of things that have changed here since their first visits. They had 4 people here: Russell Jenkins, MD, who is the medical director, Alan Vaida, who's a PharmD, Susan Paparella, who's an RN and vice president of the company, and Christina Michalak, who is PhD in medication safety specialist. When Dr. Vaida gave his program on risk identification and medication uses, we had 150 participants, and around 80 of them were from our hospital. The rest came from outside. We invited members of the Beacon Collaborative to join us in Anderson Auditorium and hear him speak. On their exit summation, they made a point of commending Washington Hospital for the tremendous progress that we've made in medication safety. And a direct quote from Dr. Jenkins, who is their medical director, was, "Wow." I don't think you get that from people like that so very easily. I think that our staff have worked very hard with the help of the medical staff, and in particular Dr. Kranti Achanta, to make these improvements in how we provide medication to our patients. They said they would be making further recommendations to encourage us to push the envelope, and you might recall that this year the Joint Commission reviewed our medication safety practice and our medication reconciliation program and deemed it best practice. So they see us being on the forefront and as one of the most advanced of all their clients. We can expect an interim report in the following month, followed by a more detailed report of their findings. We brought them here specifically to take a look at the implementation of the medication carousel. While they were here, we did discuss our intention to open the infusion center here in Washington West on the 2nd floor in October, and we will be inviting them back as that center gets ready to open so that they can review all of our processing practices around infusions, so that we don't have any unintended consequences. They've seen hundreds, if not thousands, of centers like this, and I'm sure they can point the way to ultimate safety for us. So I was very pleased with their visit. We expect them back in the fall, and they've been very helpful. This is an association that I believe has benefited our patients enormously. Certainly had a lot to do with why this hospital was named in the top 5% of the nation's most safe hospitals. And it's a relationship that I think that we should continue to have in the future. I see them as always being necessary. There are always new processes for administering medication, new devices, new systems like the Med Carousel, and most importantly, new drugs. And many of the new drugs that have been introduced in the medical communities across this country are a great deal more dangerous in the sense of their power than what we used to see 20, 30 years ago. And so judicious use of them is, and accurate use of them is of tremendous importance to the hospital and to its patients. On May 21st, we did some community outreach at the annual American Heritage Festival at the Buddhist Church in Union City. There were over 200 people in attendance. We had Lynn Franks, RN, our certified diabetes educator there. Pauline Chow, who's a registered dietitian and a certified diabetes educator, was also there. Lucy Castillo, who's operations coordinator of our community health resource library, was there. And we provided information on prevention and management of diabetes, as well as information on the community health resource library. On May 23rd, the Women's Health Center had a program on new advances in rheumatoid arthritis. Dr. Rashid, who's a rheumatologist on staff at the hospital, presented the lecture, and we had 34 people in attendance. On the 24th, we had a program on skin care and prevention of skin cancer, and Dr. Sunil Dwan, dermatologist, presented the seminar. We had 29 people in attendance. On May 25th, a company that was formerly known to us as Amgen, now called Boehringer Ingelheim, had an employee health fair, and we participated in that, and we provided osteoporosis screenings. 30 employees were screened for osteoporosis. And it was mentioned earlier by Chris Henry on May 26th, the magnet program notified Jan Wood that our magnet application had been accepted as complete without any requests for additional information or revision. And that's an extraordinary result. They advised us at that time that our tentative dates for our site visit are July 25th through the 27th. And I think Jan mentioned to them that we are in the window for a Joint Commission survey. And Maureen Lal, our magnet recognition representative, said, "Oh, that's no problem. We've surveyed with the Joint Commission before." So they don't see that as any reason not to show up. So they'll be here in July, and it's possible that we could have back-to-back surveys or simultaneous surveys. We'll see. On May 26th, we had a program in the Women's Health Center on Sorry, Gotta Run. And we had 13 people in attendance. Dr. Mark Saleo, urologist, presented a lecture on the latest treatments for female urinary frequency. On the 27th, our very own Paul Kelly was announced as the winner of the 2011 Association for the Advancement of Medical Instrumentation GE Biomedical Engineering Technologist of the Year Award. This is national recognition for Paul. Very proud of him. On June 1st, we had more programs at the Women's Health Center, and the subject was misconceptions about breast cancer. We had 10 people in attendance, and Dr. Mimi Lin, radiologist, presented facts about breast cancer, risk reduction, and screening guidelines. On the 2nd of June, we had a program for our diabetes population. The subject was vacation or travel plans, preparation and safety tips for people with diabetes. We had 25 people attend. Sandra Mertsdorf, RN, who's a certified diabetes educator, gave the program. And on June 4th, we attended the Ohlone Citizen of the Year luncheon. The The honoree this year, and I say plural honorees, were the Rotary Clubs of the Tri-Cities. Washington Hospital is proud to have on staff members of Niles Rotary, Fremont Rotary, Newark Rotary, and the Rotary Club of Warm Springs and Sunrise. And I think it's worth mentioning that Niles was the progenitor of these clubs, the original Rotary Club in town, and our very own Kimberly Hartz is going to be the president of Niles Rotary in the coming year. We were also honored to meet the recipient of the Washington Hospital Healthcare System Scholarship, Helen Harrison. She's a second-year student and wants to be a physician. On June 5th, the board had a meeting with legal counsel that Sunday morning for a discussion of healthcare reform and the things about it that we know exist today and are certain, and discussion about what might come in the future. Holland and Knight, who represent the hospital district in Washington, D.C., had two of their attorneys here to have that discussion with the board of directors. On June 7th, we gave a program on kidney disease, and Dr. David Tay, nephrologist and medical director of our dialysis service, presented the seminar. We had 35 people in attendance. In terms of upcoming health promotion and community outreach events, on June 11th, we'll be doing peripheral vascular disease screening, and we'll have both Dr. John Thomas Mahegan and Dr. Ash Jain there to be doing those screenings. On June 14th, we'll have a program on peripheral vascular disease, and once again, both of those physicians will be presenting a program on the diagnosis and treatment of peripheral vascular disease. On June 21st, we have community education on colorectal cancer and a healthy diet to prevent cancer. It will start at 1 in the afternoon and end around 3, and Dr. Vera Pan, gastroenterologist and medical director of the gastroenterology service for Washington Township Medical Foundation, and Lori Rothelson, registered dietitian, will be presenting this program. On June 28th, we'll have a program on sleep disorders and sleep apnea from 1 until 3, and Dr. Nitin Verma, sleep medicine physician for the Washington Township Medical Foundation, will be presenting this seminar. On June 30th and on July 7th, we'll be doing community outreach, the Central Park Summer Concert Series, which the hospital is once again sponsor of, and will be the presenting sponsor of this series over the summer. We'll be signing the board members up to attend as hosts. On July 9th, we will have our Advances in Neurosciences 5th Annual Bay Area Symposium. And it will start at 7 and end around 5. Dr. Sandeep Kunwar, our neurosurgeon and medical director of the Gamma Knife program, and David Larson, radiation oncologist, and the co-medical director of Gamma Knife, Moses Tagioff, who's the medical director of perioperative and strategic surgical services, and Dr. Reza Malik, who is a neurointerventional radiologist and neurosurgeon, along with other distinguished speakers, will be presenting at the symposium. On July 12th, not the 2nd, July 12th, community education will be provided on how benign brain tumors are treated. Dr. Sandeep Kunwar will be the presenting faculty. And on the 13th, we'll have a program on what to do if you've been diagnosed with bowel disease. And Dr. Vera Pan will be presenting this program. We'll start at 11 and end at noon. I mentioned already that the Healthcare Foundation held its golf tournament and the number of guests, and that we earned just over $100,000. I think it's important at this point to thank the chair of the tournament, our chair for many years now, Lamar Hinton, and all of the members of his committee who worked so hard to arrange a wonderful day of golf and an entertaining awards banquet. And I'd like to thank all the volunteers, golfers, and sponsors who helped make the tournament a success this year. The Washington on Wheels Mobile Health Clinic in May did all of its usual things. It went to the Fremont Senior Center, the Fremont Family Resource Center, the Silliman Activity Center in Newark, the Ruggieri Senior Center in Union City. It provided services at Breyer Elementary School, Kennedy High School, Irvington High School, and Mission Valley ROP, all located in Fremont. In addition, it went to Schilling Elementary School in Newark and Newark Junior High, American High, and Sunol Glen Unified School District, providing whooping cough vaccinations, helping our community be prepared so that the students who are entering in the fall are all properly immunized. They also provided occupational health services, including physicals and pulmonary function testing at Revance Therapeutics, a biopharmaceutical company. In terms of our internet, our website had 30,727 visits, 21,116 unique visitors. They resulted in 101,086 page views. Some of the links most visited included the employment section with 18,515 page views, the physician finder section with 14,989 page views, the volunteer page with 9,792 page views. About Washington Hospital had, the section had 8,413 page views, and the Women's Health and Pregnancy section had 3,088 page views. During the month of May, InHealth staff received news that an Inside Washington Hospital show, Advances in Cardiac Care, that was hosted by John Thomas Mahegan, won a Bronze Telly Award. This show features Drs. Ash Jane, Dr. John Cecil Walks, and the Telly Awards annually showcase the best work of the most respected advertising agencies, production companies, television stations, cable operators, and corporate video departments in the world, and receives more than 14,000 entries annually from all 50 states and many foreign countries. We also have good news about several projects, including a new Voices in Health show hosted by Dr. Barbara Kostick about surgical options for breast cancer. The show features interviews with Dr. William Degoni and Dr. Prasad Kilaru. InHealth also captured a public service announcement about x-rays and infants, and the PSA features Dr. Mimi Lin and Dr. Pramila Ramachandran. The Employees Association partnered with the medical staff to offer employees discounted tickets to Great America. We're very grateful that the medical staff continues to support the employees in this fashion. Nice recognition for them. 600 admission tickets and 100 parking passes were sold. The spring drawing took place on Friday, May 20th, and they had gift prizes of a Blu-ray player, a Kindle reader, and an iPod. And they also had some cash prizes. A total of 100 tickets were sold for WHEA sponsored San Francisco Giants versus the Oakland A's game. And now, finally, our Employee of the Month. She is Erica Nelson. She participated in the development of the budget presentation that you just saw. She started as a data analyst with Washington Hospital in 1996. In 1998, she left to have her first child, and then later returned to Washington Hospital in 2002 as a consultant. She applied for a permanent position in Financial Planning and Analysis Department in 2006. She's responsible for helping with financial projections for various business plans that we have, as well as the development and analysis of product lines, among other duties. She is a very dedicated and passionate about her job employee. She's very detail-oriented, and she makes sure that her teammates understand the importance of data integrity. She's a very valued employee, and it was my pleasure to make that presentation.
Thank you.
Wow.
Now we have our quality report from Stephanie.
This report of the Quality and Patient Safety Dashboard is for quarter ending March 2011. And again, you have the definitions here in terms of the meaning of the words that we use throughout the report. The goal is something that's measurable and achievable over time. Benchmark is best practice in terms of what's out there in the community and what you strive to achieve. Internal benchmark is an achievable objective or self-imposed standard within the organization based on your previous data. And comparative rate is rolling benchmark that's out there in the community that previous year that adds new data as available. Looking at patient safety, procedure timeout, for quarter ending March, we were 100%. Again, this is one of the Joint Commission patient safety goal is all or nothing, and we met the goal for that quarter. And this is a timeout that takes place before any type of invasive procedure is done. Patient safety management activities. This is a Joint Commission activities that relates to the environment of care. This is more of your fire drills, your hazmat, anything related to facilities, the testing of alarms and so forth. And again, we met the goal for March at 100%. The handoff communication is the handover of the patient care from one caregiver to the next, or from one level of care to the next. And for quarter ending March, we met the goal at 98%. Joint Commission goal is 90%. And this is something we continue to strive for because it does make a difference in terms of patient safety and providing optimal care. Hand hygiene observations continue to be a challenge throughout the country as hospitals struggle with this patient safety goal. And when you look at hand hygiene, we continue to improve over time, but it's not just about washing hands. It's even after you have washed your hands, before you enter the room, you need to not touch anything in the patient environment. So in terms of how you observe hand hygiene, it's a very stringent standard that has to be adhered to. So we continue to have an aggressive hand hygiene team. We have a lot of good physician and staff participation, and over time the goal is to improve with the hand hygiene compliance. Falls with moderate injury is any injury that requires intervention, and we are benchmarked against CalNOC, and as you know, CalNOC is a California Nursing Outcome Collaborative, and now that has expanded through to Washington and Oregon as well. We had no injury with falls for quarter ending March. Sepsis mortality, we were one of the early adopters of the sepsis campaign. The goal is to reduce it by 30%, and as you know, early identification and early treatment with sepsis save lives. There is a lot of work going on with the sepsis campaign. We are working with the Alameda County EMS so that we can begin the treatment out in the field before the patient reaches the ED. And again, we're going to have our annual sepsis community education that's going to be coming up within the next month or so. So again, we strive to meet that, to decrease mortality as it relates to sepsis. There is enough data out there right now that there are going to be published guidelines within the next year or so that gives a better indication, a better direction as far as what the benchmark or goals should be. With overall screening of sepsis, this begins on admission. So this starts in the ED, and it goes right throughout the organization. If the patient is a direct admit or that patient is transferred from another organization, we go through the same process in terms of screening those patients for sepsis. Pressure ulcer incidence, and again, we compare ourselves to the CalNOC, and we have been better than gold for the past quarters. This is one of the indicators that, Nancy talked about our patient safety recognition that we received from HealthGrade, and this is one of the reasons we received that recognition as well, is because of the reduction and having our patients in-house with very little pressure ulcers or decubitus. Looking at hospital-acquired infection rate, for quarter ending March, there were none. Remember last quarter we had 2. And again, the goal is to have 0, but oftentimes, if the patient is not screened within 48 hours, whether they came in with it or not, we own it as an institution, because the way the regs and the guidelines are written by CDC is anything after 48 hours becomes hospital acquired. So if that patient is not screened or does not meet the criteria for screening and end up with an infection, then it belongs to us. So we continue to have an aggressive team working with that under the direction of Dr. Diane Martin. Surgical site infection, this is a prevention of post-op infections as it relates to MRSA. We have gone multiple quarters without any infections. And again, I think part of this is being part of that SCIP program as well. But we continue to be vigilant about and screening these patients pre-op as well. So that has helped a lot, making sure they have the right pre-op bath before they go to surgery. So there's a lot of work being done around that. Catheter-related urinary tract infection. This is one that's that is reported both to the state and to the CDC, and now CMS is jumping on the bandwagon in terms of this is going to be reported to them in the next coming quarters. For quartering in March, we had 1 urinary tract infection that was hospital acquired, and again, you have to look at that patient condition, the comorbidities. The goal is 0, but oftentimes that's almost an impossible goal. But again, we were better than the 25th percentile. And the 25th percentile is the top 25% of hospitals in that database that has that record. So we are in good company in terms of trying to get to that 0. For central line bloodstream, this is another one that's on the radar right now in terms of reporting both to the CDC, state, and to CMS. And for quarter ending March, we had 1 infection related to central lines, and it's reviewed, and we continue to have an aggressive team looking at our central line rate. And again, with the central line, the 25th percentile is 0, the 50th percentile is 0, so they're really looking to make sure that there is absolutely no infections. And in some cases, this